Hello. This presentation relates to a study to evaluate a nursing rotation programme. And I firstly want to acknowledge my co-author, Nigel Jennings, formerly of North East London NHS Trust, and Debbie Smith, the Director of Nursing for Patient and Practice Experience, who initiated the evaluation. The work was undertaken in 2020 when I was working at the University of East London. Rotation programs for nurses are usually used as a recruitment and retention initiative and to broaden newly qualified nurses' clinical skills. However, a unique feature of the programme being evaluated here was the primary aim of developing competency across both physical and mental health care. In line with the Trust's vision, as you can see here, to close the gap between physical and mental health and develop a workforce who can promote holistic care. You can see here that the programme lasts 18 months and typically includes rotation between 3 different clinical settings and also has support and training built in. The Trust is an integrated community and mental health trust and has a workforce of 6,500 staff. The evaluation was guided by Di Marks-Moran's healthcare education evaluation framework that she developed with colleagues at Kingston University and focuses not only on student or participant evaluation, but also the impact, value and sustainability that the programme has. We also interpreted the overall data with reference to Hugh Barr's extended version of Kirkpatrick's classic training outcomes model, again so that we could consider impact in relation to organisational and patient benefit as well as student satisfaction. You can see here the methods we used included a survey of both participants and also their clinical supervisors and managers. And also we conducted focus groups and document analysis of things like competency assessments and other programme materials. Although the NHS guidance considered this an evaluation of service improvement, we did follow ethical guidelines around consent and confidentiality, but also importantly to create a sense of security in the separation between the trust management and facilitators, and myself as the researcher from outside the trust and not involved in any way in the programme. The participants were all nurses, those on or recently completing the rotation programme from adult mental health and children's nursing backgrounds, or their clinical supervisors or managers, and 37 staff in total were involved in the evaluation, completing either the surveys or taking part in the 4 focus groups. We had 3 focus groups with rotation nurses and 1 with practice educators. Those involved were drawn from across 4 years between rotation programs that had taken place between 2016 and 2020. And you can see that typically the nurses were newly qualified with this rotation post being their first job, although some had more experience. The key themes of what we found can be seen here. Around student satisfaction, holistic care and service development, and then an emerging theme when the evaluation was completed of the impact the rotation had on the Trust's COVID response. You can see from these quotes that the participants rated the programme highly in relation to their own development and satisfaction. And then in relation to holistic care and patient-centred care theme, the highlighted quote sums up things, but the other quotes give some examples. For example, of working in a psychiatric liaison service, but how having a greater understanding of physical health needs, of understanding the jargon and being able to challenge, in this other case, stereotypical misunderstandings about mental health, which could have impact on more intrusive care than was needed. Here, in relation to service improvement, the rotation nurses and their managers backed up the impact the programme had. Here are just a couple of examples related to acute children's ward, where the rotation nurse helped create an anxiety box, or a resource in a mental health team to signpost better information on wound care. As I said, the evaluation started before the pandemic hit, and then after a pause, we resumed. So an emerging theme were comments about how the rotation had either given some staff more confidence when moved to adult wards. Here, a mental health qualified nurse working on an adult physical health ward, and also work with the homeless who were rotated to a local hotel that was taken over as part of the local authority response to pandemic, ensuring that both mental health needs were taken into account as well as physical. As I said before, we use Kirkpatrick's model extended to reflect interprofessional health education by Hugh Barr to get an impact about, an idea about impact. You can see here that all 4, or should I say 6 in the extended model levels were addressed, from the reaction level impact through changes in knowledge, skills and behaviour, but also importantly changes in relation to patient benefits and organisational practice. And that's an important finding to justify continued resourcing of the programme. There are some limitations, obviously, to this small evaluation, the sample size being small, partly an effect of a decision we took not to chase survey responses once the pandemic had hit, and the impact assessment, is based on reports, but albeit, they are from managers as well as participants, and no cost benefit effect analysis. We believe that the programme, though, is fit for purpose in that it meets its internally stated aims, and also in comparison to the literature on what preceptor or rotation programmes should look like. Wider issues you can see here to consider going forward are the concerns from the participants about whether the programme will be recognised in other trusts, especially those staff who have secured jobs at the end of the programme outside of their normal. So, for example, a mental health qualified nurse working in a district nursing team, and also concerns about how to maintain skills. The resource implications of scaling up the rotation, especially the downtime from clinical practice to attend support and training aspects, are recognised, but we think these need to be balanced against the benefits of creating more agile and a more flexible workforce. Thank you for listening. If you would like further comments or you have further questions, then please do email me or contact me via Twitter. Thank you.